Hello, my name is Justin Smith, and I'm doing my Web of Causation presentation on heart disease among adults. What is heart disease? Heart disease is a very general term that many ailments fall under. These do include ailments of the heart, but also include ailments within blood vessels that connect to the heart. The most common and fatal of all heart diseases is coronary heart disease, also known as coronary artery disease, which is a disease of the arteries in which plaque builds up and restricts blood flow, which in turn may restrict the flow of oxygen to important areas of the body. Other forms of heart disease include heart infection, congenital heart disease, which is heart defects, and arrhythmia, which is irregular heartbeat. Coronary artery disease can lead to many other ailments, including heart attacks, strokes, and heart failure. Heart attacks occur when oxygen flow to the heart muscles is restricted due to blockage in the arteries. Stroke is when arteries leading to the brain are blocked, restricting the flow of oxygen. Heart failure, when the heart can no longer keep up with what the body demands of it. What are the symptoms of heart disease? There are multiple kinds, so we'll go over a few. Coronary heart disease. Symptoms include angina, which is sharp pain in the chest around your heart. And the second is pain in multiple areas in the body, including the throat, neck, jaw, and abdomen. Symptoms for a heart attack include chest pain, neck pain, heartburn, fatigue, vomiting, and shortness of breath. Symptoms for arrhythmia include fluttering feelings in the chest. Symptoms for heart failure include shortness of breath, fatigue, swelling in the lower half of the body. There are many ways to diagnose heart disease. They include an electrocardiogram, which measures the rate and regularity of the heartbeat, an echocardiogram, which is an ultrasound of the heart, chest x-rays, coronary angiogram, which uses x-ray technology to trace dye through the bloodstream, able to use to find plaque deposits and blockages in blood vessels across the body. Cardiac catheterization is when a catheter is used to travel through the blood vessels to look for plaque deposits and blockages. And then there's the exercise stress test, which measures the heart rate while on a treadmill to measure how the heart works when it has to pump more blood. In regards to general population prevalence of heart disease varies by race. Native Americans make up 18.4% of heart disease, Asian Americans 22.2%, non-Hispanic blacks and non-Hispanic whites both make up 23.8% apiece. There are approximately 27.6 million people in America living with heart disease. Roughly 1 million of these are children and adolescents, with the vast majority of them dealing with congenital heart disease. Men are more likely than women to suffer from heart disease. Women develop heart disease 7 to 10 years later than men. Most heart diseases become more likely once the individual reaches the age of 40. Adult population prevalence. 26.6 million adults suffer from heart disease. That's 11.3% of the adult population in the United States. Older adults are more likely to suffer from heart disease than young adults. Individuals age 80 plus with heart disease make up 51% of those with coronary heart disease. Coronary heart disease is by far the most prevalent form of heart disease in adults. Roughly 7 in 11 adults with heart disease suffer from coronary heart disease, which in turn can lead to many other heart issues. Determinant: tobacco and smoking. According to a study done by Katsiki, even though cigarette smoking has the worst impact on heart disease, other forms of tobacco and smoking do have a negative impact as well. These include cannabis, pipe smoking, smokeless tobacco, and cigar smoking. If you need more information on that, please look to the right on that diagram. The study also found that all forms of cigarettes, including light and ultralight versions, contribute to heart disease. Stress is commonly associated with the use of these forms of smoking and tobacco use, which in turn can aid the development of heart disease. Cigarette smoking increases triglycerides in the bloodstream, which has been linked to increased risk of heart disease. Smoking also increases LDL cholesterol in the bloodstream. In high levels, LDL cholesterol can lead to coronary heart disease. Determinant: high alcohol intake. Many misunderstand the connection between alcohol use and heart disease. According to Klatsky, research shows that light to moderate consumption of alcohol actually helps deter heart disease, where excessive alcohol use increases the likelihood. Amount of drinks considered excessive was 3 or more in one sitting. Excessive alcohol use leads to an increase in triglycerides and LDL cholesterol, which contributes to coronary heart disease. There is evidence to support that light to moderate consumption is beneficial, but it is still unknown as to why it is beneficial. Stress and depression have been linked to excessive alcohol use, which in turn can lead to heart disease. Determinant: sleep apnea. Sleep apnea is an ailment that affects roughly 5% of the adult population in the United States. Symptoms for it include sleep fragmentation, episodes of gasping, and partial or complete closure of the pharynx while sleeping. According to a study done by Ghazal et al., people with obstructive sleep apnea syndrome, OSAS, are likely to suffer from coronary artery disease more severely. The study used the Berlin questionnaire to put subjects into two groups. Those groups were high and low likelihood of OSAS. The group that had a higher likelihood of sleep apnea was more likely to suffer more severely from coronary artery disease than those in the low likelihood group. This means that the study shows there's a link between sleep apnea and CAD. Determinant: low SES. According to a study done by Cohen et al., low socioeconomic status can be a determinant for heart disease. As exercise is a key part of preventing heart disease, the study looked to find out which groups of adults had the better capacity or ability to exercise. The study found 1,024 adults of varying types of incomes, education levels, housing, and occupations to conduct exercise tests with on a treadmill. The study found that those individuals who had low levels of the four criteria on average had much worse exercise capacity than those with higher levels, which in turn means those individuals have a higher likelihood of heart disease. The study also refers to other studies in which low SES is associated with stress, as well as the risk factor of an unhealthy diet. It states that low SES individuals are less likely to have the ability to keep up with a healthy diet due to the lack of funds, as well as the lack of viable grocery stores to buy healthy foods. Determinant: old age. According to a study done by Hatmi et al., individuals above the age of 55 are more likely to be involved with risk factors that lead to heart disease. The study included cigarette smoking, high blood pressure, and high blood sugar. The study surveyed 31,999 people. It was set to screen people into two groups under 55 and greater than or equal to 55. After the survey was completed, the research showed that the people in the older age group were more involved with specified risk factors. So this is my web of causation model, with heart disease in the middle and then the 5 determinants around it. I will start off with tobacco and smoking. I have the 5 types of tobacco and smoking around it connected to it, which are pipe, cannabis, smokeless, cigar, and cigarettes. Then I have sleep apnea, which has no other factors connected to it, but it is directly connected to heart disease. Then I have low socioeconomic status, which is connected with lack of exercise and poor diet. And then it is also connected with stress, which in turn connects with high alcohol intake and tobacco and smoking. Then I have old age, which is connected to high blood pressure and high blood sugar, which then old age then connects to cigarettes, which in turn connects with tobacco and smoking. Then I have high alcohol intake, which connects with stress and depression. Social work perspective. In regards to heart disease, many social workers do not know much about it. It is suggested that social workers obtain an understanding of the diseases that make up the broad umbrella of heart disease. Evidence suggests that the mental and social needs of clients with heart disease are unmet. It is suggested that social workers who do not know how to work with these patients on the mental and social level go through a psychosocial training in regards to heart disease. In regards to professional practice, it is suggested that we as social workers fight to build professional models that are beneficial to older, minority, and other oppressed populations besides services offered to the general population. Community-based response. My community-based program is called HealthWorks Community Fitness, which is a non-profit organization that has engaged in an exercise referral program with a health center 1/8 of a mile away. This program is specifically targeting poor adult women who the health center feels need to exercise as a part of their treatment. The goal of the community-based program is to get women involved with a free fitness center that can help them develop and carry through with an exercise plan to benefit their cardiovascular health and to build self-efficacy in regards to their workout regimen. The program operates through a 3-pronged approach, which combines behavioral, social, and environmental factors to help make things convenient for their clients. The program has been considered effective for the individuals who stick with it. Unfortunately, roughly only 40% of referred individuals even use the service, and only 10% of those who begin the program through referral actually see it through properly for 3 months. The program needs to find a way to keep their referrals involved once they begin. In conclusion, things that you need to know are that heart disease is a general term that applies to all ailments of the heart and the blood vessels. You need to know that coronary heart disease is the most common form of heart disease among adults. Adults make up the vast majority of those suffering from heart disease. Social workers should look to be informed of all forms of heart disease for use in future practice. And the determinants for heart disease are tobacco use and smoking, high alcohol intake, sleep apnea, old age, and low SES. And these are my reference slides. Thank you for taking the time to watch my presentation. I hope you learned more about heart disease in adults.